You know, there are a variety of factors that might impact that decision. So we look at the parent and the child and their coping, and then how the interaction between the parent and the child are going as well. So, um, you know, if you have a parent that's reporting that he or she is very overwhelmed by the diagnosis, that suddenly they're maybe having some sleep disturbance, that they're having racing thoughts, that they're having difficulty kind of paying attention to things that normally would not have caused those problems. All of those are red flags that they're not coping really well, which basically means there's been a stressor that they're being asked to deal with, and they maybe don't have the resources, either financially, emotionally, psychosocially, to address that stressor. And usually with this diagnosis, it's an elimination diet, it's the child vomiting, the child not growing. All of those are extremely stressful. So with the parent, you look for those sorts of red flags, just in kind of global sense that there's some coping issues going on there. So those are some of the red flags for the parent. And for the child, then we look for developmental regression. So maybe mom comes in with a 3-year-old who's been potty trained for 6-8 months, and suddenly they're wetting again, or they're having accidents throughout the day. So there's some developmental regression, or the child suddenly wants their binky again, or they get in bed with mom and dad when typically that's not a behavior that was present. And the parent is also saying, like, my child's tantruming more, my child appears fatigued or tired more frequently, not getting along with siblings. All of those things are kind of red flags that would indicate a mental health professional would be helpful. It's not always a psychologist. There are other mental health professionals that can be equipped to help with those coping skills.